Hello, good afternoon everyone. I'm Exceptional Nurse Debs and I'm back to your timeline. So in this video, I'm just going to tell you how to differentiate between the mental health hospitals and the general hospitals, which is for those nurses that did adult nursing. So if you're seeing me for the first time, I make content around job application, NMC UK CBT, NMC UK OSCE, the OET, which is for doctors, nurses, midwives. If you are a medical professional, the OET is for you, and I tutor all of this as well. So if you think you will benefit from any of them, please leave me a message on my TikTok handle and I'll be happy to support you. So my YouTube channel is Exceptional Nurse Debs. I have different videos there. If you think you'll be needing support around coming down to the UK to work as a nurse, I think my YouTube channel is your best to go to. Then on my TikTok, I've also posted some few videos. I'll be posting more on my TikTok page. My TikTok is Exceptional Nurse Debs. My YouTube is also Exceptional Nurse Debs. So let's dive into it. So how would you differentiate adult nursing hospital, which is the general hospital, from the mental health hospital? So most of the time, the mental health hospital always have partnership on it. So let's say you go on track and you're trying to look for a particular hospital to apply. Let's say you're a mental health nurse and you come across any hospital that has partnership, just know it's a mental health hospital. So we have one of the hospital. Let me use the one that's very close to me here. It's called Leeds and York Partnership NHS Foundation Trust. So that hospital is in Leeds, but it's a mental health hospital. So this is something as a mental health nurse that you can apply to. But as a general nurse, if you see any hospital that has partnership, just know it's not for you. So you should be looking for hospitals like, for instance, York and Scarborough Teaching Hospital. Should be looking for hospital that has maybe teaching hospital or on the names, or the one that does not have partnership on it at all. Yeah, so these are the hospitals you should be looking at for. I'm actually making this video mostly because of the mental health nurses who have reached out to me over time to how do I differentiate these hospitals. There are also some hospitals that do not have the partnership attached to it. So like Priory is for both adult nursing and mental health nurses. So you can also apply to Priory. So maybe they will just clearly stated there that, oh, you need to be a general nurse or maybe a mental health nurse, maybe on the job criteria, so you'll be able to differentiate if they're actually looking for a general nurse or a mental health nurse. Then also there are other hospitals like Liveware Southwest. That particular hospital is both for general nurses and mental health nurses. So it's on the job description that you'll be able to differentiate which of the nursing that they actually which of the nurse that they're actually looking for. Is it a general nurse or a mental health nurse? So I hope this video will be able to differentiate all of that for you. However, there are also some exceptional cases where a general hospital, like a teaching hospital, also have mental health department, and they call them the liaison nurse. Like it will be like a nurse who works in a teaching hospital. It will be like the first point of contact for a patient who has mental illness. So when they come into an emergency unit, the mental health team will come and assess if maybe the patient is agitated or maybe behaving in a certain way, and they feel like these symptoms are actually mental health symptoms. Then the liaison nurse will come and assess this patient. If they feel like, oh, these are symptoms of mental illness, then they will assess them and reach out to the professionals like the SOHAD, the HAM, who will come and assess this person and say, oh, this person has mental illness. Then they will now refer the person to a mental health hospital. However, if the liaison nurses assess this patient and they don't feel like it's a mental health symptom, then they can now admit the person in the general hospital. So some of the general hospitals, they do have liaison nurse, and most of the time you actually see from band 6. They usually take from band 6. I've hardly seen a band 5 role in a teaching hospital. So what I'm just trying to say here is there are some general hospitals too that employ band 6 mental health nurses, and they call them the liaison nurse. So they work in a teaching hospital. I hope this video helped you. I'll be making more of this type of content. If you think you've benefited from this video, or maybe you benefit from videos like this, please do not hesitate to follow, like, and share my content. Also, if you need a particular video that you want me to talk about, I'm happy to talk about it. Is it OSCE? Is it OET? Is it CBT? I'll be happy to support. Just leave it on the comment section. Thank you. See you in my next video. Nurses are what? Nurses are smart. Keep pushing till you get there. Bye.